Case Investigation Form or CIF is an important document to get the epidemiological data on the disease. Evidence generated by this data help in development of strategies for prevention, control, and elimination of the disease. In this video, we will learn about filling of CIF for suspected measles rubella case. CIF has to be filled for all the cases having fever and maculopapular rash in last 90 days. Or if clinician or health worker is suspecting it is a case of measles or rubella. Let's now learn how to fill the form through a case study having reported by a health facility. Here is the reported case study. You can pause the video and go through it. Let's start filling the form section-wise. The first section will be filled by DIO or SMO office. A case is sporadic until and unless it is part of an outbreak having 5 or more suspected measles cases or 1 suspected measles death. Notification and investigation information. The case was notified on 24th January and was investigated on 25th January. Always remember to mention the type, category, and setup of the notifying health facility. Notification and investigation details help us to assess the sensitivity of the surveillance system. Under identification details, ensure that date of birth, address, and mobile number is correct and complete. This helps to trace the case and provide the feedback to patient on lab result. There is no history of hospitalization in this case. Section 5 on immunization history is important to see whether the case has received measles rubella containing vaccine or not, and if missed vaccination, assess the reasons for missing the dose. The child has received first measles dose on 10th March 2014 but has not received second dose due to awareness gap. In July 2018, a measles rubella campaign dose was received by the child. Section 6. Encircle the clinical history for type of rash, fever, cough, coryza, conjunctivitis, enlarged lymph nodes, joint pain, and any complications. As per the case history, child had rash onset on 14th January and fever onset on 12th January. Always remember to mention the vitamin A doses received. Always remember that date of rash onset is the most important date in disease epidemiology and must be elicited correctly. Take complete travel history in each case and write the addresses in the CIF. The case might have acquired the disease where he or she has stayed during the incubation period, and the case should be cross-notified to the concerned district. Most infectious period for measles is 4 days before and 4 days after the onset of rash, and based on travel history, contact tracing and active case search should be done at these places. From patient or caregivers, get details about any similar case among other household members, neighborhood, school or workplace within last 28 days. Any additional cases found with similar symptoms should be investigated if they meet the case definition. Section 9, 10 and 11 highlight the health-seeking behavior of the case or community. As per the case study, the child has contacted community worker Mrs. Rama Shinde, ANM, and healthcare providers Dr. Prasad and Dr. Meenakshi. The data from health-seeking behavior firstly help in understanding cultural practices following rash onset. Based on these findings, interventions for surveillance and immunization can be planned in the community. Secondly, data from health facility contact helps in identification of all the health facilities which a suspected case may have visited. This information helps in sensitization of health facilities for timely notification of suspected cases for appropriate public health interventions. In the Section 12, provide the provisional diagnosis as per any available record or clinician's opinion. In the Section 13, fill in the details of specimen collection. Remember to mention reasons if sample is not collected. If the case is in the window of till 7 days of rash onset, then in addition to blood sample, collect either of throat swab or urine sample or nasopharyngeal swab for virology. If the case is in window between 8 to 28 days of rash onset, collect only blood sample for serology. In this case, only blood sample collected on 25th January. Virology sample not collected as the case was notified after 10 days of rash onset. Active case search in neighborhood community is important to identify all the suspected cases as well as the susceptible for early intervention. Any additional suspected cases should be investigated if they meet the case definition. Once lab result is available, DIO or SMO office should share it with patient, community worker and health facility and update the Section 15. Follow-up of every case after 30 days of rash onset to be done by health supervisor or medical officer and inform the status to DIO or SMO office. This gives information about post-measles complications, death or additional cases in the community. Sections 17 and 18 are for early identification and follow-up for risk of congenital rubella syndrome in newborn if the suspected case is a pregnant woman. Section 19 is the last section of the CIF on final case classification. Based on lab results, the final classification to be updated on CIF by DIO or SMO office. CIF is an important document for providing evidence of measles rubella elimination. Keep all the sections updated as and when the relevant information is available. EPID number is assigned by DIO or SMO office. This is 15-digit alphanumeric unique code for each suspected case. It consists of disease code, country code, state code, district code, year of rash onset, case serial number. India has targeted measles and rubella for elimination. Report all suspected measles cases.